Next, I would like to introduce our keynote speaker, Sara Zingsheim. Hopefully I said that right. Sara worked for 15 years as a public school teacher before making a career change and becoming a professional mental health counselor. The past decade, she worked in the private clinical setting, and in the summer of 2021, joined forces with a colleague to open Best Self Counseling Center in Port Washington. Sara is trained in DBT and specializes in working with adults who have experienced complex childhood trauma. Utilizing the skills and understandings from DBT, she helps her clients find both acceptance for everything that has led up to the present moment, while also working on changes important to capture a life worth living. And so I would like to bring Sara up to kick us off for this excellent symposium that we have for you today.
Thank you. Yeah, I'm hooked up at my cheat sheets. Well, thank you everyone for being here, and I'm so honored that Mary reached out to me to speak with you this morning. I looked at the website for WPA, and I noticed with the other presenters who you all get to meet with today, a real common theme. And the theme is looking at what we are struggling with, looking at what our challenges are, and how we can approach them to be better, to live our best life with Parkinson's disease. Chronic illness, we know, has such a profound impact on our physical well-being and our emotional well-being. And if you look at those two parts of who we are, they aren't separate, they're integrated. It's one machine. And so one profoundly influences the other. So if you look at Parkinson's, it can impact our eating, our movement, our sleep, our speech. And it can in turn then create emotions, anxiety, frustration, anger, discouragement, depression. And if you look at those emotions of depression, anxiety, discouragement, anger, and fear, those in turn can create physical things such as bladder and bowel issues, or sleep disturbance, appetite disturbance. And so they're so connected with one another. And so what we want to look at is what can we change? What can we do in order to make those two parts of who we are balanced? So we have a balanced understanding of who we are physically and the changes we can make there. And we keep that in balance with how we feel, who we are emotionally. I look at what it is we can change in the first place. And it's very limited, actually. Imagine everyone right now, a big line, like extending across the horizon. It's a pretty big line. And on that line are all of the things that we cannot change, all of the things we cannot control. I'll give you one. When I got here this morning, it was drizzly and kind of icky, kind of cold. I can't control that. We can't control the weather. So weather's on the big line. Chronic illness, disease to ourselves or to the people we love, that's on the big line. We can't change that. We can't control that. Accidents, we can be preventative, but we can't change that accidents happen to people we love and to us every day. We look at other things like death, the big one, or the two big things that bring people into mental health counseling every day. The past, can't change that, can't control that, it happened. Or other people, what other people think, how other people feel, their beliefs. We can't change that, that's not ours. The things on the big line aren't ours to control or to change. And some of us jump up and we try to grab at the big line, and that can create so much anxiety and sadness and overwhelming feelings in us. So I want everybody to hold up their pinky and look at the length from one end to the other. That's the size of your line. That's the size of our line. And there's only 4 things that we all have on our line. Thank goodness, because I don't want all that responsibility of all those things on the big line. That's too much. The 4 things on our line are our thoughts, our emotions, what we do, and our attitude. So what we think, how we feel, what we do, and how we do it, and that's it. And if we approach those things that are on the big line that are in a lot of our lives, and we keep in mind what we can control, what we think about it, how we feel about it, how we can approach it, the action steps we are able to take, and the mindset, the attitude by which we take actions, then we're setting ourselves up on a place where we can feel like we are managing our lives, that we can have that best life with Parkinson's. So I wanted everyone to be able to move into this amazing day with these amazing presenters that have so much good material for you, and all of the vendors out there. I want you all to be present today and really mindful of this day. So anything that you have, any anxieties, worries, things that are in your future, like, oh my gosh, what are we making for dinner tonight? Let that all go and be here today. And one great way to really practice being able to be present is daily meditation. It can be as simple as a breath meditation. And if you're going to my breakout at 10:30, we're going to do a very easy breath meditation. And you can also do guided meditations on apps and finding YouTube videos. And there's so many ways to find guided meditations. And what that allows for is our brain to just hear, to be focused, to be present. And so I'm going to actually help us get our brains open, present, receptive, relaxed for this amazing day ahead of us by welcoming one of my friends and colleagues up here to do a really beautiful guided meditation. So I really want you all to just get comfortable, let your shoulders kind of drop, and close your eyes if you're willing. Just find a comfortable position. And Lori's just going to guide us through. It's one of my favorite meditations. When she read it to me, I honestly felt like I just had a massage. I looked at her, I'm like, oh my gosh, Lori, can you start every one of my days with this meditation? So I wanted to give you guys the gift of this guided meditation because I want you all to feel really relaxed today and open to all the wonderful things you're going to experience and hear and learn from all of our presenters today. So thank you.
Think of a color that represents healing or calm for you. Now imagine a ball of light in that color above your head. That ball of healing color can open, and a stream of that calming light comes down through the top of your head. The light streams down your face, relaxing the muscles around your forehead, your eyes, nose, mouth, and jaw. It continues to stream down the back of your head, into your neck, and all the way down your spine. As it flows down your spine, you feel each vertebra relax. The healing light comes down through your throat and into your shoulders, into your arms, elbows, your wrists, hands, and fingers. Everything it touches is soothed. Next, that healing ball of light comes down into your chest, calming your heart, your lungs, down into your stomach, through your pelvis, hips, and down into your legs. That stream of light goes down through your legs and into your knees, your calves, ankles, feet, and toes. You imagine that light can stream out of your body from the bottoms of your feet and down into the earth, taking with it any tense or unneeded. The light releases that negative energy into the earth where it can be recycled into something better. Now I want you to think of another wave of that colored light streaming down from the top of your head through every cell of your body and out the bottoms of your feet. Whenever you're ready, you can be done with that. Have a good day today.
So next up, I would like to introduce our medical panel and research updates. So I'm very honored and excited to introduce Dacy Reimer, who will be facilitating the panel from Neuroscience Group. Dacy has been instrumental in helping us plan the symposium and has been highly involved in WPA. Dacy is a nurse practitioner and researcher with over 25 years of experience. She specializes in the diagnosis and treatment of movement disorders and dementia, and offers novel advice and care to her patients and their families so they can work together to develop a plan for lifelong independence. Her comprehensive care plans offer support through nutritional and fitness guidance and state-of-the-art pharmaceutical treatment. Dacy also has a long-time association with WPA since 1996. So many of you in this room know Dacy. Dacy, can you wave and show everybody where? I know you'll be coming up here shortly. She was previously the education and outreach coordinator for WPA. She is a speaker at WPA conferences and a webinar presenter. Currently, she serves on the medical advisory committee for WPA, and she is also the new facilitator for the NINA support group. So anybody in that area should check that out as well. And if you receive our magazine, Dacy was also featured in there for the through hike that she'll be doing, which I'm inspired and amazed by as well. So I would love the medical panel to come up here, and Dacy will introduce the rest of them. Thank you, guys.
Hello and welcome. So glad you could all be here with us. I've been to so many of these symposiums, and this is a fantastic turnout. So just wanted to welcome you all. Everybody's so quiet and peaceful. Wasn't that wonderful? Oh, good thing we didn't do that after lunch. So I have a wonderful research panel that we wanted to share with you, especially most of the local research that's going on here within the state of Wisconsin, and you might not know about that. So oftentimes, we know of maybe that global picture, or some people, follow certain websites on research, but maybe in your neck of the woods, you don't know what else is going on around the state of Wisconsin. So it's really a privilege to have all of these presenters. I'm going to actually introduce them individually, if that's okay, so that it's not a long list of biographies. Our first speaker is my wonderful colleague, Dr. Lisa Kokontis. She works with me at the Neuroscience Group and has been there for many, many years. Dr. Kokontis is a specialist who specializes in the diagnosis and treatment of neurologic conditions of the brain, spine, nervous system, such as stroke, headache, MS, movement disorders, degenerative disorders, vertigo, dizziness, and infectious disorders of the peripheral nervous system, and movement disorders such as Parkinson's disease. Please welcome Dr. Lisa Kokontis.
Hello, everyone. Can everyone hear me okay? Yeah, good. Welcome. You don't know how excited we are to have you here today. And this is not just a day in the making of this. This was months and months of people working day and night to get this together. And Kelly said it all, the people to thank behind the scenes. And I also want to make sure we thank Dacy, because she has put this, also has owned this from the very beginning and has put her heart and soul into today. So thank you very much. Dacy. She should be like the poster child for Parkinson's, I think. So, you know, when I see someone with Parkinson's disease, you come to us because you're having some symptoms, and what am I going to do about these things? And we diagnose you. You know, I think you have Parkinson's disease. You know, you're a little slow, and you're a little tight, and you have that tremor over there. And we really, really focus on the treatment aspect of Parkinson's, because we want you to be functional and better than when you came in. But you know, those treatment options wouldn't be possible if we didn't have the research that brought those things to market. We're talking about medications, but we're also talking about medical devices, infusion therapy, all sorts of things that are on the horizon for people with Parkinson's disease. And so I am probably the worst about this, but I'm making a mental note for myself to encourage myself to not only treat your symptoms, but encourage each and every one of you to become involved in clinical trials. We don't think about that enough, and we think, hey, we're in Wisconsin, what's going to be, what's my opportunity here? I probably have to travel. Well, that's not true, because the internet's very wide, and you can easily find sites to go on, which we'll go into in a minute, that will open up your world to the clinical trials. You know, about 85% of clinical trials are slowed down because there's not enough volunteers. And about 30% of clinical trials don't even get off the ground because they don't have anyone signed up to volunteer for them. So we need you now, and we need you urgently. And even if you don't have Parkinson's disease, but you're sitting there with your loved one, you also can sign up for clinical trials, because we need controls in some of these trials. So I thought my role today is to sort of guide you through a couple of the websites that I tell people about, because they're super duper easy. Brady is going to help me with that. We're going to put up, the first website is clinicaltrials.gov. Has anyone heard of that one? No, a few people, yes. So what is this website? Well, it's a database sponsored by the National Institute of Health, and it includes almost 450,000 clinical trials in the world. I can't remember if there's 200 countries involved, all 50 states in the United States are involved. And they submit their studies to this website, and so people can see what is available to them. It's very easy. When you put this website into your browser, you'll come to this page, and it says find a study at the top. You could go to all studies or just recruiting studies. Unless you really want to see what's finished up, you can kind of look, and you can even check out their results on that site. So if you go to recruiting, or not yet recruiting, if you're interested in signing up, and then you put in Parkinson's disease as the next row down, if that's what you want to endeavor. I want to stay in the United States. I'm not willing to travel. You can put USA. I want to stay in Wisconsin, and I want to stay in maybe Milwaukee, give or take 100 miles, and let's see what pops up here. Cool. So look at all these. What did they? I can't see the top number, but it's going to give you all of the clinical trials that are available within 100 miles of Milwaukee. Look at that. There's 30 some. And if you click on one of them, it will bring you to the purpose of the study, what they hope to study, what is the inclusion criteria. In other words, am I going to be chosen for this? Do I have the right characteristics they're looking for? And also the exclusion criteria. I can't do this study because I might have lung disease and I can't do this study. So it gives you the inclusion, the exclusion criteria, and at the very bottom, it'll give you the contact person to contact if you're interested in this. So it's a phone number or it's an email address, and it's as simple as that. So you can look at this for really any medical condition you want. You don't have to put in Parkinson's disease. You could put in giant cell arteritis, and you'd come up with the same number of things. So exciting, exciting. So that's clinicaltrials.gov. The second website I'm sure are all familiar with is the Michael J. Fox Foundation. Who's heard of that? Good. So you could go to the Michael J. Fox Foundation, I think it's .org, and under Take Action, you can go to Join a Study. And here they're going to be talking about one of the initiatives with the Michael J. Fox Foundation is the Parkinson's Progression Markers Initiative. And Dacy's going to go through that a little bit, or one of the findings of that study. But what they're trying to do is gather as many people, normal and not, or people who have Parkinson's and who don't have Parkinson's but may be at risk for it, and to try to study as many factors of their condition as they can. And they're hoping to get over 500,000 people enrolled in this. Right now, there's 1,400, so there's quite a ways to go. The next one is the Fox Trial Finder, and it's pretty much the same as the clinicaltrials.org. You can click on, I think you have to keep going down to the bottom, or no, find a study, sorry, yep. Here we go. And same thing, you can put in Parkinson's disease or any of the other Parkinsonian diseases. There's 405 studies that they have listed, so you can click on that circle. And again, you can come up with the same kind of clinical trials worldwide, and you can filter based on location. So it's pretty easy, don't you agree, that to find a study or even some of these are studies that involve a medication or a modality. Some of the studies are questionnaires. They simply want to know what your characteristics are, what medications you were taking, how healthy were you in your lifetime. Those are easy things to do, and they can send you the questionnaires either through the mail or through your email, and just about anyone can do that. In fact, last night I signed up for the PPMI because I figured, you know what, I can help out. I'm one of 500,000 people. It's an easy thing, and so every quarter I'll be getting a questionnaire about just those things, my medical health and so on and so forth. So I encourage you all to think about signing up for a clinical trial. It's very easy. And with that, if there's any questions, I'll take them at the end, and we'll keep going. Thank you very much.
Thank you so much, Dr. Kokontis. I also wanted to add that one of our initiatives with the Wisconsin Parkinson Association is to expand on the website availability for all of these, the access to any of the clinical trials and that as a tab. So keep tabs on the Wisconsin Parkinson Association website because that'll be an additional key piece for those of you who are interested in research. Our next speakers, I actually have two, but we're going to come up one at a time. The first, both are from Froedtert Medical College of Wisconsin. First is Michelle Maynard. Michelle is a pharmacist in the Froedtert Neurosciences Clinic, specializing in providing medication information and education to patients and healthcare professionals. She began her practice as a hospital pharmacist in the neurologic intensive care unit, later transitioning to clinic-based care. She has a passion for neurology and helping link people with the treatment options that best fit them. Please welcome Michelle Maynard.
Thank you. I'm here today presenting a little bit of information about clinical trials on behalf of Marie Majecki, who is our research coordinator at the Medical College of Wisconsin. She has a little bit of stage fright, so she's like, you do it. So I said, okay, I'll do it. So what is our agenda for today in the next couple of slides? First, I want to give you some background information into a little bit about how clinical trials are organized and the kind of terminology you might hear if you're looking to enroll in a clinical trial. Then I'll walk you through what's available currently and coming up at the Medical College of Wisconsin. And then also, very importantly, who to contact if you're interested in any of the clinical trials that we have available to you. So what is clinical research? This seems like kind of a basic question on the surface, but most of us really aren't participating in clinical research in our everyday life. So some people aren't really clear on what does that mean. Really what that is, it's like studying both the health and the illness of people and how we can impact that. As researchers, what we're looking to do is find answers to those areas that we really just don't have right now the best information. We want to be able to provide the best possible care for our patients, either with medications or with other kinds of treatments. And clinical trials give us information about what's working, what works the best, who does this work the best for. And so this is really the goal, is to get you involved and help us help you better. Some basic terms that you might hear if you're going to be enrolled in a clinical trial are, many people have heard placebo and know what that is. It's often referred to as a sugar pill, but it's really an inactive substance. Why does this matter? A lot of our medication trials compare a potential medication to placebo. Sometimes it will also compare multiple different doses of the same medication to placebo to give us an idea of how effective a medication is. If you're randomized into a clinical trial, what randomization is taking all the people that are enrolled in a trial and randomly assigning them to a group. This helps us to make sure that all of the different groups are well represented, and it also helps us to reduce the amount of bias that might be involved in what the data shows. So it gives us a better picture of who things are effective for. And then finally, what is double-blinded? What is that? So this is when both you and your study team really don't know whether you're getting the placebo or whether you're getting an active medication. And this is important because a lot of times your study team is doing assessments about how well this medication is working for you. And if they know that you're on a medication, they might want to attribute more of the success that you're having to a medication. And if you're not on a medication, if you're on that placebo, they might not want to attribute it to placebo. So, being double-blinded really gives everyone the most objective data available. As a pharmacist, I like to give people kind of a background on how the FDA really reviews medications. There's a lot of steps involved, and so the things that come to market aren't randomly there. It's been years in the making, and there have been a lot of people involved that have participated in the clinical trials that lead to eventual FDA approval. First, there's preclinical testing of drug entities. This is usually in the lab with beakers or other equipment. And then later on, this is possibly in animals as well. Only when a medication looks like it could have potential in humans do the drug companies present an application to the FDA so that they can begin clinical trials. So you will never be involved in preclinical testing because that's not where people fit in. In phase 1 clinical trials, companies will take actually a small group of healthy volunteers to understand what are the side effects of this potential medication and how is it cleared from the body. So interestingly, most of the time, even though the medication is meant for a group of patients as a treatment, those aren't the people that are involved in the clinical research. In phase 2 clinical studies, what we're looking for is making sure that medications are safe in the patients that are going to be taking these medications. So this is where you might be asked in a clinical trial to be involved if you're as a person with Parkinson's. What they're looking at is they've got a medication, they think that it's going to work for Parkinson's, and now they need people with Parkinson's to actually take the medications, and they're going to look at what doses might be the best dose, and they want to make sure that the medication really is safe. The phase 3 clinical trials take a more in-depth approach, and they look at how effective is this medication, how effective is it compared to other medications that we have available, and it really rounds out the information that we have both in safety and efficacy. These clinical trials are often anywhere from a few hundred people up to a few thousand people. It kind of depends on the number of people with the condition in question. So it varies quite a bit. And then once phase 3 has been completed, this is when the FDA takes a look at the total amount of data and says, yes, you can market this drug, or no, you can't. Once the company has been authorized to market the medication, this is where you've got post-marketing surveillance, or what's sometimes referred to as phase 4 clinical data. And this is really not something that's part of a clinical trial per se, but the companies and the FDA will often make sure to take a look at all of the adverse drug events that have been reported, and they will do follow-up analysis to make sure that nothing that was like a rare occurrence in clinical trials or things that didn't show up in clinical trials, that there's no new things going on that we need to evaluate and potentially make changes for. So it's a very ongoing process, and one that doesn't always stop after the medication becomes approved. Okay, so now that you have a little bit of background about clinical trials on the whole, let's meet our team in the neurology clinic. Some of you may already know Dr. Blindauer, Dr. Brennan, and Dr. Jakowiak. If you are part of a clinical trial at the Medical College of Wisconsin, even if you don't follow with them locally, you may see them for clinical study evaluations as part of your clinical trial care. And this is our research staff. This is Marie, Taylor, and Deanna. They're research coordinators, and they are responsible for providing you information if you're thinking about enrolling in any of the clinical trials, making sure that you would meet the criteria that are involved for the clinical trials, providing you with study medication if you qualify, and making sure to maintain really good records, both for the study sponsors and potentially also this kind of data will be reported to the FDA. So they're very meticulous folks. And at the end, Marie's clinical information is there. She will be happy to assist you in getting hooked up with any of the clinical trials that you may be interested in. And Deanna is also has the following one. So the PD Generation Genetic Registry is actually not a medication clinical trial. This is one that Deanna is coordinating. So if you're not yet sure if you're interested in taking a medication as part of a study, to Dr. Kokontis' point, there are a lot of ways to be involved in research, and this is a fairly easy and your overall time commitment would be very low as well. Really what the goal is to create a repository of genetic data to be used in research for Parkinson's. Your overall time commitment is providing some clinical information and having DNA data collected through a mouth swab. And you can get enrolled either in person at the medical college or you can do it remotely as well. So you can get enrolled in a clinical trial from the comfort of your home. It's pretty easy to do. The next clinical trial that is available is a phase 3 clinical trial of ANVS 22001. And this is looking at a couple of doses of butanetap or a placebo. And this is really thought to be helpful in reducing neurotoxic aggregates, which we think may be part of the causative factors of Parkinson's. It is an oral medication that's taken once a day, and your time commitment is going to be taking the medication for a total of 6 months, with up to 6 weeks for a screening period in addition to that. If you're interested, some of the other inclusion and exclusion criteria are age between 40 and 85, and you have to be on a stable medication regimen the 4 weeks prior to study entry. Also, you need to have less than 2 hours per day of off time to be enrolled. So if this is something that sounds interesting to you, give Marie a call or send her an email. Then another clinical trial that we have is a phase 2 clinical trial, and this medication is a tyrosine kinase inhibitor. That's the number. It doesn't have a name yet, so, and I won't try to go through that, but it is also a once daily medication that you would be taking for a total of 3 months, with about a month and a half for screening and follow-up of safety. Because remember, phase 2 clinical trials also look at safety. So the main inclusion and exclusion criteria here, this is really a trial for newly diagnosed people with Parkinson's and that have not been on medications for Parkinson's yet. And we're anticipating this opening in May, which is just around the corner. So there's not a lot of time to wait before it opens. And then we also have ITI 214, which is lenrispodun, which is a phosphodiesterase inhibitor. This is a relatively short clinical trial. 30 days of medication with 5 weeks for screening and follow-up as well. For this particular clinical trial, what they're looking for is people that are having motor fluctuations and have at least 2.5 hours of off time during the time that they're awake during the day. So this is the people that we're looking to enroll in this particular clinical trial. If you've already had to do OPA or DBS, then that you would be excluded from the clinical trial. And this particular study is slated to open later in the summer or early fall. And I'm going to hand over the mic to Dr. Hassan, and he's going to talk to you a little bit more about his intervention.
I'm going to just introduce Dr. Hamza Hassan. Dr. Hassan is a gastroenterology fellow at Froedtert in the Medical College of Wisconsin. He specializes in motility disorders with a focus on oral pharyngeal dysphagia and esophageal dysmotility. Dr. Hassan integrates a multidisciplinary approach in his practice to provide patient-centered care. Please welcome Dr. Hassan.
Hello, can everybody hear me? Thank you. One thing that I'd like to say about Parkinson's disease is it evokes a lot of passion among the patients and their family members. And I've talked to some of you guys, and one thing that's important is there's so much we need to learn about Parkinson's disease. And only by participating in these studies and these clinical trials can we work to improve our quality of life so that this disease does not become your identity. It becomes a small part of your life, and we can focus on improving your quality of care, the quality of your life, and help regain your identity back. So I'd like to thank the organizers for fitting me in at the last minute to talk about my clinical study. So as we know, exercise is important with people for Parkinson's disease. The Parkinson Foundation and multiple other institutions talked about the importance of exercise in improving quality of life and help reducing the physical manifestations of this disease. And we, as a gastroenterologist, we'd like to use that same principle in improving improve swallowing in patients with Parkinson's disease. As some of you may know, up to 80 studies estimate that around 82% of all people with Parkinson's will develop issues with swallowing. That's a scary number. And a lot of you people would know people who have difficulty swallowing, whether they're the people having lunch with you and they start coughing, or it takes them longer to swallow, or people who might get hospitalized because they have a lung infection called pneumonia. These are signs that something needs to be done. And our study uses that principle of strengthening your muscles, inducing fatigue, and that causes your muscles to strengthen and improve their function. We have developed a device that applies a little bit of resistance to your Adam's apple and helps train the muscles associated with swallowing. Could we go to the next slide, please? And this device has been shown to be effective in improving the swallowing biomechanics in the elderly population without dysphagia. And it is being used clinically at the Medical College of Wisconsin, and we would like to start to evaluate its role or its function in patients with Parkinson's disease. Now, the question that you guys might have is, how do I know if I have dysphagia or difficulty swallowing? Do I How do I know? Well, it's a tricky question. What we have seen is quite a few people do not develop symptoms or do not feel that they have dysphagia while they actually have it. So we are enrolling anybody who has a diagnosis of Parkinson's disease, where we will evaluate your swallowing function and have you trial out this device, and we're able to actually measure the biomechanics of your swallowing to tell you whether there has been any improvement in it. And this device was created by Dr. Reza Shakir at the Medical College of Wisconsin, and he's a leading expert in this device, and we're happy to offer it to anybody that's interested. Thank you.
Our next speaker is Dr. Jessica Baker. Dr. Baker is a neurologist at UW Health and assistant professor in the Department of Neurology at the University of Wisconsin School of Medicine and Public Health. She specializes in movement disorders and other serious neurologic conditions. In her practice, Dr. Baker treats movement disorders including Parkinson's disease, Huntington's disease, tremors, dystonia, ataxia, and drug-induced Parkinson's. She also cares for patients with ALS and other severe neurologic illnesses. Dr. Baker's approach to care focuses on collaboration with other specialties and clinicians, communication, and patient-centered treatment by working with patients to mutually decide on care plans that represent their personal goals. She just strives to maximize each person's quality of life. Dr. Baker conducts research on the medical and surgical management of Parkinson's disease and the importance of patient-provider communication in neuropalliative care. Please welcome Dr. Baker.
So good morning and thank you. What an honor to be here. I am one of 5 movement disorder specialists at the University of Wisconsin in Madison. So on behalf of myself, as well as Dr. Shannon, Dr. Dent, Dr. Gallagher, and Dr. Manjan, thank you again to the organizers for the invitation. So if I could have my next slide, please. So I'll spend just a couple minutes talking about some of the clinical trials that we have open to folks at UW. So the first is the TOPAZ trial. So this is a trial of zoledronic acid, which is an FDA-approved medication that's actually already widely available for the treatment of osteoporosis. And this study examines whether or not this medication can help decrease the risk of fractures in patients with Parkinson's disease. So it is a randomized, double-blinded, placebo-controlled trial that can actually be done completely in your home. A one-time infusion of this medication, and it is open to adults with Parkinson's disease or those with a related neurodegenerative condition, which would include some of the atypical Parkinsonian disorders or conditions such as vascular Parkinsonism. Unfortunately excluded if there's a history of a hip fracture. And this study is sponsored by the National Institute on Aging and is currently open and enrolling new patients. There is more information available on the study's website, which is topazstudy.org. If I could have the next slide, please. So the PROSEEK study is also currently enrolling at UW. So this is a study of a drug called K0706, which is an inhibitor of an enzyme called the Abl tyrosine kinase, which is thought to be involved in the oxidative stress and mitochondrial dysfunction that drives alpha-synuclein aggregation and neurodegeneration in Parkinson's disease. So this is also a double-blind, placebo-controlled study of this study drug, which is given orally daily. And this is a trial that looks at the potential of this medication to be disease-modifying. So we know that for folks with Parkinson's, medications like levodopa or Sinemet help with symptoms, but they don't necessarily slow the progression of the disease. So this study is open to adults with Parkinson's disease who are very early in their clinical course. So this is for folks who are not yet on medications like levodopa for Parkinson's disease and don't anticipate needing that within the next 9 months. So this study is currently open and enrolling new participants. It's industry sponsored. If I could have the next slide, please. We heard a little bit about this already from Michelle. So this is the same trial that's being done through MCW. So this is a trial of IKT 148009, which is also a c-Abl inhibitor. It's an oral drug given once daily with meals. Again, looking at the progression of motor and non-motor features of Parkinson's disease over about 12 weeks. This is also a study for folks with very early Parkinson's disease who are not on anti-Parkinsonian therapy yet and not anticipated to need it for the duration of the trial. And we too will be opening this for enrollment soon. I will take my next slide, please. So this study is a study to evaluate the effects of SAGE 718 in participants with Parkinson's disease and cognitive impairment. So this is a study of SAGE 718, which is also a once daily oral medication given for 42 days to evaluate its effect on cognitive performance in patients with Parkinson's disease and mild cognitive impairment. So this is for folks who generally score between 20 and 25 on the Montreal Cognitive Assessment, which is that quick pen and paper test that I imagine many folks here are familiar with from clinic. So in individuals that are also functionally independent, so do not meet criteria for dementia. This drug's also being studied in other neurodegenerative disorders, including Alzheimer's and Huntington's disease, also enrolling soon, so stay tuned. I will take my next slide, please. And the last study is a two-part study of two drugs looking at dyskinesias. So just as a reminder, dyskinesias are those extra movements that we sometimes see as people fluctuate between their doses of levodopa and relatively advanced Parkinson's disease. The study drug is a combination of buspirone and zolmitriptan, both of which are available for the treatment of anxiety and migraines. And the outcome that's being investigated is reduction in dyskinesia severity in folks with Parkinson's disease. So this is for adults with PD who have had dyskinesias for at least 3 months that are at least moderately disabling, and for those that may be already on it for the treatment of dyskinesias willing to stop amantadine. This is industry-sponsored and will be enrolling soon. I will take my final slide. So if you are interested in learning more or participating in these studies, here is our phone number, here is our website, and I wanted to say a special thank you to Kim Janko, who's our research nurse, not only for her efforts in coordinating our trials across the department, but also for helping me with these slides and coming here and joining as a volunteer today. So thank you all for your time.
I just wanted to add, when we talk about clinical trials, you can stay with your provider and participate in clinical trials at other facilities, in case you were kind of wondering about that. Oftentimes you're treated locally, but you can participate in those clinical trials at one of the research centers as well. I think we're going to run out of time today, so I think what we're going to do is maybe just take about 5 minutes of Q&A, if that's okay. I'm going to leave kind of my part out just because I think we're running out of time. We're actually going to be taking a break in about 5 minutes. Did anybody have any questions that they wanted to ask one of our presenters? Yes, sir. What does off time mean? So some people notice, and this can happen later in the disease process, that the cells get sensitized to the peaks and the troughs of medications. And off time is basically a time during the day when your symptoms reemerge. So oftentimes it can be early in the morning because you've just slept all night and maybe took your last dose before bed. So in the morning you can have what we call early morning akinesia, meaning a slowness in the morning where whatever your baseline symptoms were, whether it was tremor, stiffness, or slowness, maybe reemerge. So people can find that maybe closer to the timing of their dose, the clock doesn't tell them it's time to take the dose, their body is telling them to take the dose, and we term that as off time. Good question.
Anybody up on the panel, what type of research is being done on DBS. What is the effectiveness that you're finding with DBS?
Any of you want to speak to that at all in particular? No? As far as research goes, I think you'd probably want to hit the deep brain stimulator groups that we have here today. There are 3 different representatives for deep brain stimulator programs. That research tends to be ongoing. Obviously, we have it approved for things like benign essential tremor and Parkinson's disease and dystonia, but there's a lot of more ongoing research for like depression and some of the mood aspects of some of those non-motor symptoms, as well as major depressive disorder for deep brain stimulators. But they're constantly working on newer devices that can hone in more. When I do programming for deep brain stimulators, that can fine-tune that capacity for improving symptoms in Parkinson's disease.
I was wondering about what the panel thinks about the high-intensity ultrasound using MRI at Rush Medical Center in Cleveland. They do it for treating essential tremor, and they also say for Parkinson's disease.
So I actually just returned from a meeting about 3 weeks ago in Croatia, where that was a big hot topic. And at that meeting, it's kind of neat because we have a panel discussion, and we have one person who kind of fights for the yes, you should do this, and another person who says nay. And they present all of the data out there. One of the leaders of that was a researcher from Greece, and they had really kind of taken the lead on that focused ultrasound. It is something that we do. It's more for benign essential tremor. The kind of big take home that day was the fellow who was doing the nay was from Mayo Clinic, and when they came down to it and got done arguing the point, pretty much everybody in the room said, if you're going to do it, go to Greece. They have the best results. So, that's basically a kind of a new take on a pallidotomy, which was a gamma knife. It was a procedure that was done many years ago that was more invasive. This is via ultrasound. It's had mixed results. You can only do one side. They've found if you do both sides, people end up with a lot more ataxias, meaning more balance disturbance. But I think you have a lot more. Even at that meeting, there was a lot of dispute, and it actually ended up kind of going more for the nay, that the results weren't as good as what they had hoped for. Obviously, we have plenty of programs. Like you said, Rush, I know, does the ultrasound. It's really a matter of knowing that ultrasound still does have a lesional effect. So it's a heat ultrasound that has a lesional effect in the area that they're directing. And as far as the tremor control, I haven't had a lot of great people come back with great results so far. Maybe you guys have, maybe you have had greater results than what I have. But so I think that it's debated yet a lot. Anybody else want to tune in or pipe in on that?
What's most important when you're considering an invasive procedure, even ultrasound is invasive because it's lesioning, is getting the perfect patient picked out for each of those modalities. With the focused ultrasound, it's great because if you're not a surgical candidate, in other words, I have a bad heart or lungs, or I can't undergo general anesthesia, then that's probably the thing you'd want to do if your tremor control is bothersome. However, if you have Parkinson's disease and have pretty bothersome tightness, slowness, as well as tremor, I think, and you're a good surgical candidate and you still have a good result with your levodopa that predicts that your result with deep brain stimulation is going to be adequate. And in that case, and you have years to go in your life, I think deep brain stimulation is the way to go. So you can see from this, it's just you have to consider each person individually, their symptom and their other medical conditions. So it's just kind of not a yes, no, but it's more complicated than that, and your doctors understand this as well. Do you have any other?
Largely echo everything that's been said. For patients with advanced Parkinson's disease, both DBS and focused ultrasound are highly effective tools if medications are not doing what they need to for the duration of the day. And in the right patient, both DBS and focused ultrasound is a highly effective therapy. And I think, as Dr. Kokontis was saying, the most important part is there are advantages and disadvantages to each of those procedures, and it is a very, very nuanced decision if you are thinking about a surgical therapy. And I'd encourage you to really talk through all the options with your doctors, with your care team, to understand exactly what it is that you're hoping to get out of that procedure. And from there, you can work to try to decide which of those is the best fit.
So we're going to end it here, if that's okay, just so that we keep the day rolling well. I just wanted to say again, thank you so much to our panel. You lend a lot of insight and information. And obviously, if you catch them in the hallway, you can always ask questions. So thank you so much.